All right, everybody. All right, so we are on the downhill to the end of the term, so we're in week 6. Homework grades have been turned on, so you can kind of see what your KGAs are right now, and I will leave them on through the next exam, which is next week. So you all have the dates for the exam reviews. Is everybody planning on attending an exam review? All right. So like I said earlier, to this week's concepts, we have occupational health, environmental health, learn barriers to learning, and reinforcing health education. So we'll go ahead and get started. Did anybody look at the YouTube video that was posted for this week? No, just asking. So there's some resources.
Talking about the one on hospice.
The concept review, or that's in the week 6 announcement.
Oh, no, I didn't get to look at that one yet.
All right. So get it, if you get a chance, look at that. The Kahoot is in there for exam 2 as well. In the announcements for week 6, you have your student notes as well. And like I said, your homework grades are turned on, and I will leave them on until exam 2 grades are posted so you guys can see where you stand. It is recommended, and I will recommend, and anybody that has a KGA below 78, please reach out and schedule a time so we can meet, and get everybody back on track so they can be successful with the class. So who's heard of occupational health before? Anybody? Okay, so what is occupational health?
Is it like your workplace? Your workplace?
Right, it's something to do in your workplace. Um, so what do you think occupational health does?
Does it have something to do with OSHA, making sure that the working environment is not subpar?
It does have something, it does have something to do with OSHA as well. So when we look at occupational health, and I will share my screen. I know you guys have the PowerPoints, but I will share. So here's the PowerPoints. So when we look at occupational health has been around for a pretty long time, and has a variety of different functions. All work environments have risks, right? No matter where you work, whether it's nursing, whether it's in a fast food restaurant, in a department store, right? There are all sorts of risks that are involved. Healthcare in the workplace seems to or seeks to promote health as well as to prevent occupational illness and injury. So this is one of the things that your occupational health department would function to do. Um, and so workplace assessments, learning about processes, materials, job requirements. The nurse can conduct assessment of the workplace to learn about the work processes, the materials, what potential hazards there may be. What are the work practices of the employees? What about, even observing the effectiveness of safety education and training? So just think of a nurse. Just think of, even if you use your clinical experience or, past experience, if you're CNA or another, in another part of the medical field, what are some hazards that you may come across as a nurse working in a hospital or long-term care or a doctor's office? Doesn't matter.
Exposure.
Needle,
Exposure
needle
to,
sticks.
okay,
Mm.
needle sticks, what other exposures?
All kinds. Biohazards, disease, viruses,
Okay, so
different
virus,
types of viruses like the herpes or something.
okay, all right. What other potential hazards do we have?
Like fires or natural disasters.
Fires, natural disasters, improperly working equipment. Um, what about
Mental health.
mental health? What about violence? I mean, unfortunately, violence is another hazard that healthcare workers are exposed to as well. Um, and then, of course, there's injuries, right? What's the number one injury for nurses?
Lower back.
Back strains, right? So, we have to look at that. So, an occupational health nurse too will see injuries and diseases that the person can acquire from just working in that environment. And like I said, every single industry is at risk for serious hazards related to work. So it's not just nursing, right? It's anywhere that you work. Um, and so one of the big things with occupational health is, nurses function in numerous roles within the workplace. They're challenged, big part of what we do is, right, providing cost-effective, high-quality care to our patients. And so one of the goals of the occupational health nurse is to develop partnerships with, safety personnel, human resources, health insurance agencies, because if you get hurt at work, occupational health is where you are going to go. And so having those relationships as an occupational health nurse is super important. Another thing, so we're going to look at that occupational health nurse. They're the ones that are going to assess the risks for work-related illnesses and injuries. They're going to plan and deliver health and safety services within the workplace. They'll collaborate with community health providers. They'll also work to facilitate some health promotion activities. So there's a lot of things including, you know, reporting, counseling, crisis intervention, legal and regulatory compliance, worker and workplace hazard detection. So it's not just, them going out and looking to see what is out on what is on the unit, but they have to be able to jump in case they need to. So when we look at case management. So let's say you get hurt on the job. Um, you trip or slip on some water on the floor, you trip over a cord, or you're repositioning and pulling on that patient and you hurt your back. Um, so they are going to help you to coordinate and manage your care. Um, so, what doctors are you seeing? How long are you going to be out of work? If you do come back to work, are you going to be on a limited duty status? Do we need to get in contact with your nurse managers, your supervisors, in order to assist with that process as well? Um, and it's not always just physical injuries, right? It could be, psychological, mental health issues as well. Um, They work, directly with workers' compensation. They help with, filling out FMLA paperwork, your disability benefits, with counseling and crisis intervention. They, counsel for issues like if there's any substance abuse, any of those psychosocial needs, any health or wellness promotion concerns. They also may assume responsibility for and managing employee assistance programs, um, or referrals to employee assistance programs. Sorry, trying to answer chat. Okay. Um, and then even coordinate the follow-up. Is anybody who works in healthcare now? Anybody currently working in healthcare? Do you guys have occupational health where you work?
I work at a regional hospital. Before that, I worked in another hospital in the same healthcare system, and I believe there is one in place only because we were like, not to say it like that, but we were like repeat violators because the Joint Commission was always there. So I do think that there is some things in place, but I've never actually seen, it's never gotten to the point where it's like things had to be changed or there was a huddle or an emergency meeting about anything that was below the standard. So I haven't seen it, but I think the evidence is there that there is some there. Being that it's a hospital, I would assume so.
So if like with occupational health, so especially in the larger hospital systems, when it comes to, your new hire, onboarding, they're the ones that would make sure that you have your immunizations, they'll draw your titers, they'll do that kind of thing, your initial physical coming into a facility.
Mhm. So is
So
it like the outpatient part or like the employee health?
yeah, employee health. Employee health is occupational health.
Okay.
So it's the same thing. So some people call it employee health, others call it occupational health. But yes, it is the same thing. So they're the ones that are going to help you, as you get started into an organization. Some of them even will do like cholesterol screenings, right? Blood pressure screenings, that kind of thing, to assess, you know, the employee as they're getting ready to start. So it does kind of help. They also can provide education about positive lifestyle changes, all right, help to reduce the risks, right, with high blood pressure, stop smoking, exercise, weight control, stress management. They, in some cases, will help to monitor some of those chronic diseases. So there are some things that that there are some very good aspects of occupational
I
health
have a
care.
question.
Yeah.
Would they be also involved in like the drug screening, not for like a new employee, not like a new employee health packet, but like if medications went missing and like the whole floor needs to be tested, would that also be something that was included? Because if they're find positive for something or like alcoholism, they need to get referred to like rehabilitation and stuff like that.
Yeah, if they think that there is an impairment, and I can't speak for every employee health or occupational health department, but yes,
Mhm.
if an employee gets injured on the job, drug testing is usually required for any injury that occurs, then yes, they would be ones that would collect the specimens.
Okay.
Same thing if there was an impaired nurse, right? That would be another one of their responsibilities as well. But it depends on how the departments are set up. Not every department is, every employee health department is run the same way.
Okay. Thank you.
And not everybody has one. So yes. Um, They're also going to work with OSHA and other, they have to be aware of OSHA regulations to help make sure that the facility is in um, compliance with OSHA regulations. They also may even, be part, make sure that HIPAA is being followed. But other things, we look at some of the other things that we are exposed to. So we talked about viruses, we talked about needle sticks and bacterias and diseases, right? What about chemotherapy drugs? Right? Chemotherapy drugs are very hazardous drugs that we are potentially um, exposed to, as well as those airborne agents as well. Muscle strains, right? Lifting, pulling, stretching. A lot of times we're lifting loads that are pretty heavy when we consider, some of the patients or clients that we're taking care of. Temperature extremes, noise, lighting. Um, and then, of course, what about burnout and stress? And then we talked about violence. So these are all things that we need to take into consideration. So one of the other things too that occupational health nurse or the employee health nurse is going to do is to identify those agents and what other other factors within the workplace to eliminate or minimize the exposure and to prevent potential health issues. And so they will do walkthroughs, so work site walkthroughs, excuse me. Um, they can do surveys too, as well to get like a workplace assessment to identify potential hazards within the workplace, also to kind of get a feel of, what the stress level is in those areas. Um, they can also look at hand washing and what are, the work practices of the nurses and other members. And it's not just nurses. When we talk about occupational health and employee health, it's everybody that works in that area. So it's your housekeeping, your nurses, your doctors, your, ancillary staff, your therapists, it's everybody. So again, it's not just nursing, but like, how often are people washing their hands? Um, are we, disposing of waste properly? What is the routine for housekeeping? And I'll give you an example. So we had a room, we call it was a room that nobody wanted to go into. We didn't want to put patients in. We had a patient that had C. diff. Everybody, I'm sure, at this point in life knows what C. diff is, right? So we had a patient with C. diff was in this room, and for and it was a rehab, so it was a rehab bed. So anytime another patient went into that room, they developed C. diff, whether they were taking an antibiotic or not. So it took a while. And finally, we went in and we observed housekeeping and how they flipped the room to get ready for the next patient. And what we realized was they were wiping off some of the surfaces, but they were missing a lot of the other surfaces, right? The bed rails, the bed frame, the the bottom part of the night of the bedside table. And so
Ew.
basically, C. diff was just living in that room waiting for its next susceptible host, right? So we had to go in and we had to re-educate our housekeepers on how to effectively clean those rooms, right? So that we could prevent that from occurring again, right? So these are things that, that employee health, that occupational health nurse is going to go and look at. When we look at preventing health, you know, um, work-related injuries, you know, making the, um, safety and health education programs for the workers, right? What are the proper body mechanics is another big thing. How to prevent those workplace injuries and accidents from occurring. And again, making sure that everything is up to OSHA standards. So let's break it down into primary, secondary, and tertiary when it comes to working with occupational health. So primary we know is prevention. So teaching good nutrition, talking about, or I'm sorry, teaching coping mechanisms, healthy diet education, educating on ergonomic lifting or protective equipment. It also could be providing information on immunizations, right? The importance of immunizations. Hepatitis B is a big one, right? That we encourage everybody to get working in the healthcare field. You have a higher chance of hepatitis B exposure than you do HIV, right? So getting your hepatitis B vaccines. With secondary is screening, right? So screening for hearing loss, blood pressure, screening for stress, for burnout, counseling referrals, right? Preventing further limitation when it comes to that secondary. And then tertiary is, restoration, right? Or treatment. So if they have an injury, this is their limited duty program, providing illness or injury specific education, right? You wrist splints for carpal tunnel, back braces for back pain or back issues, right? So we can tie that all together. We look at environmental health. What are some concerns? Tell me what environmental health is. So this is back, more so in that community. Think about the environment that you live in. Has anybody started their vulnerable populations project yet? Have you
Yep.
done any of your driver rounds yet? No. All right. So environmental health hazards are responsible for half of the total burden of disease, which is pretty significant. So they also contribute to about 80% of our communicable and non-communicable diseases and injuries. So think about that. That's a lot, just environmental. Um, Environmental health too is determined by genetics, by socioeconomic status, by the environmental exposures. Um, so let's start with socioeconomic. Why would socioeconomic status influence environmental health?
Because what you can afford is going to dictate where you live. And sometimes, if you don't have a lot of money, you may have to opt out for something that is in the best condition as far as air quality, water quality, child care, education.
Okay, very good. Absolutely. Right. So those that live in poverty are going to be more likely to, be exposed to those environmental hazards, whether it's they have, crowded living conditions, they live closer to hazardous waste, poor quality food availability. Some also may have more hazardous jobs, right? They may live in older homes with that lead-based paint. They may not have the best schools and the best daycares, right? So those are some things that we need to take into consideration, right? Um, what are some what are some of the environmental exposures? Think, just what are some things that we are exposed to? Just anybody, not even those that are living in poverty. What are some of the exposures we have?
Contaminated water,
Okay, contaminated water. What else?
Poor air quality due to traffic or construction.
Okay, poor air quality, traffic, construction, carbon monoxide, right? Um, even,
Radon in
even
Pennsylvania,
going out,
anyway.
huh? Say
In
that again.
Pennsylvania, we still have radon. We still have
Oh,
radon and radiation problems in Pennsylvania. So
okay. So yeah, I mean, so you go outside and, what if you live closer to a factory or a large industrial areas, right? That's potential for both, your air quality as well as your water quality as well. What are some of the toxins that we're exposed to? We talked
tar,
about lead,
yeah,
um,
like the smell
pesticide.
of it when they lay down that fire layer of the tar, like the black shiny
Yeah,
part that smells really, really bad.
that would be more like your air pollution. Yeah. Tar does stink. I'm not gonna lie, I agree with that. But your lead, your pesticides, asbestos is still around as well. And so when we're assessing our patients regarding environmental health risks, we're going to ask about where they live, where they work, where they go to school, or where do they send their children to school. So I know this was a really long time ago, but just as an example, when I was in high school, I don't remember what year it was. I just know that went to go back to school after Christmas vacation and school was closed, which is weird. We didn't even get a notification, but that's a whole another story. Um, and so it turns out that there was asbestos in the ceiling in the gym and some other areas. And so they had started the process of asbestos removal, thought they could get it done in the 2-week vacation for Christmas. And it turned out we were out of school for an additional month because of the asbestos removal. So, yes, I know that was a long time ago, but buildings, there are still buildings, some of our older buildings that may have asbestos insulation, right? That could potentially be an issue. Um, there's mercury in fish, right? So how much fish do they eat? The pesticides are always going to be a concern. Um, your
Do what
GMOs.
with them? Danny didn't empty the trailer or nothing yet.
Sahara, we can hear your whole conversation.
Oh, sorry.
So again, that's where that windshield survey that you are going to do as you get ready to complete that project. It's going to help you look to see what your community looks like, the factories, the dump sites, the transportation routes. You're looking at the age and the condition of the housing. Are there pest problems? What, in the rural areas, are they spraying with pesticides and herbicides? Do they do it by plane? Everybody, I don't know if I've seen them, they have the planes that drive over or fly, not drive, but fly over the fields, right? And spray the pesticides and herbicides down. Um, and so the Delta area in Mississippi, they have high rates of disease, and they're one of the ones that use the planes to spray the herbicides and the pesticides. We talked about lead-based paints prior to now, right? We talked about lead exposure, more so in those houses that were built before 1978. But pesticides, we use them even in the house. If, anybody that's ever sprayed some Raid, right? Whether for whatever reason you're using pesticides, they use them in schools, right? They use them all over the place. And a lot of these are, potentially hazardous. Um, there was a story, forgive me, because I don't know how long ago it was, but a lot of people use like the Roundup for like weed killers. Has anybody ever? And you attach it to your hose, right? And you can spray. And a kid died because they had used the Roundup, of course, had taken it off the hose, but then the chemical was still in the hose, and the child drank from the hose and was ingested some of the poison. And so these are things that we have to take into consideration. Kids are going to be much more sensitive to the effects of toxic chemicals, right? Um, whether it's, whether the exposure is in utero or, after birth, um, childhood cancers, autism, asthma, obesity, your neurodevelopmental delays are all associated with toxic exposures. So we really need to be careful. Um, water pollution is another big thing. There's about 30 million people in the United States that drink water that does not meet the EPA's state safe drinking water standards. That's a lot. Um, the quality of the water is tied to the quality of the soil and vice versa. So most of our fresh water is groundwater. Anybody ever seen the movie Aaron Brockovich? I
Yeah.
was old when I say, okay, so look at what happened in Flint, Michigan with all of that, right? So, and that's still an ongoing issue today. Water is also contaminated by antibiotics, by hormones in our meat animals, um, you know, wastewater treatment systems from, the plants in the factories, um, runoff from paved roads, parking lots, erosions, right? Chemicals run off from the soil into our water. So there's something that we do have to take into consideration. And so the list can go on and on, right? We can also look at food and food products that have been contaminated with bacteria, pesticides, radiation, medications, right? These are all things that we know can have negative effects on our community as a whole. Um, so I talked about that. Sorry, I went ahead. So food contaminants and food handling. So some areas, in order to work in like a fast food restaurant or even another type of restaurants, they require you to have a food handler's license. Other areas do not. It really just depends. Um, but salmonella is a big one, right? So teaching proper food handling practices, how to prepare your foods, how to store foods, proper hand washing. What foods hold salmonella?
Chicken.
Chicken is big. Was it? I can't think of. It wasn't lettuce. What was it?
It
Um,
was lettuce a while ago.
was it
It's
lettuce
like
or
green. Yeah,
romaine?
it was
It was
Lettuce
lettuce.
one
and
of
cookie
those.
dough.
That, they had to do a huge recall, right? Couldn't even go to the restaurant and order a salad, right? Because of that risk. So there's a lot of things out there that we have to pay attention to. So as nurses, right, our goal is to encourage the participation of the public to improve the environment. And so here as community health nurses, we can do individual as well as population risk assessments to kind of see what is going on in the area that we are living. And that's why it was brought us back to you doing your vulnerable population assignment, because that's going to give you a really good idea of what's going on in your area, and some of the risks that are potentially there for you. So I'm going to say, I'm not going to go to learning yet. So when we look at environmental health, right, and assessing the clients, so the I Prepare is a mnemonic that we can use to determine current as well as past exposures. So I is for investigate. We can look at any of the potential exposures that they have had in the past. P is for present work. So this is, where are they working now? What exposures do they have? What personal protective equipment do they use? Is there anything, just like when we were talking about the rural workers, right? Are they bringing things home to their family on their clothes, right? In their cars? We look at R as residents. How old is their home? Their heating. Have they done any recent remodeling? Any chemical storage? What type of water are they using? Is it city water? Is it well water? Environmental concerns is E. Again, that's going to be your air, your water, your soil. Are there waste sites or landfills nearby? P is for past work. That also is their exposures, farm work, military, seasonal. How long did they work in those areas? A is for activities, because we know some of the activities and hobbies that we like to partake in can also be potentially hazardous. So gardening, fishing, hunting, burning, pesticides. Do they use alternative healing and alternative medicines? And then R is for referral and resources. So things like your EPA or your Environmental Protection Agency, OSHA, health departments, environmental agencies, poison control, right? Just like if we had that child that had a really high HUD level, right? We're going to report that to the health department. Um, and E is for education as well. How do we reduce the risk, prevent, and what follow-up needs to be done for the patients? So that's all your questions that you're going to ask. So you can, again, your housing, how old is it? What is everybody's occupation? Does anybody smoke? Are there recent home modeling? What hobbies are we doing? Are there any recent exposures to chemicals or radiation? Do they have pets in their home? Okay. Are they pets healthy? Um, any lead exposure? What is the source and the quality of the drinking water? How is sewage and waste disposal of in the home? So this was something I thought was really interesting when I was doing when I was in my bachelor's program and I was doing my clinicals. I actually spent half a day. They were these three ladies, they were nurses, that worked for the health department, and their job was to go out and survey the land prior to building, which I thought was pretty interesting. But primarily their focus was on wells and septic tanks. So they would go out and they would look at the land and they would look at the slope of the land and that kind of thing. I don't know all the technical things. It was actually pretty interesting to watch them at work. Right? Because if I have a sloped land, right, I don't want to have my septic tank up here, my well water down there, right? Because anything that leaks out of my septic tank is going to then get into my well water, right? So they had to look at the proper placement for those things, which I thought was really interesting and it made a lot of sense. Um, but that's something that we would have to look into. Do they use pesticides in the home or the garden? Or is there any water damage, right? Or evidence of mold or fungus around and inside the houses? Is there where do their kids play? What does the equipment look like, right? When you look at, the potential hazards within a playground, right? Is the equipment up to standard or are there broken pieces, things that they could potentially get hurt on? And then what other, neighborhood surrounding area, could present hazards, right? So other things like auto repair shops, dry cleaning, photo processing, those all use a lot of chemicals, that if not disposed of properly could get into either the ground or the water, right? So there are some things that we need to look at, sorry. And there are national healthcare goals or national patient safety goals that would fall into this, things like, reducing the toxic air emissions and, helping to prevent those waterborne disease outbreaks. The blood levels, right? Testing our kids for blood lead levels. I'm trying to think, so how do we reduce, um, air pollution, right? So think of like carbon monoxide. This is where there's been a big push for people to you find alternative methods. So instead of everybody driving to work, right, maybe using public transportation, carpooling, right, those kinds of things. Monitoring for diseases or conditions that are caused by environmental hazards. Making sure that schools have proper practices for health and safety. So there's a lot of things out there within the national patient safety goals that we can consider when it comes to environmental health. So with all that being said, what would be a primary prevention measure for environmental health?
I'm sorry, that question is really obtuse.
Is really
Maybe a
what?
little bit more specific.
So primary prevention
Like
is,
it's really like a large, like
okay, so
it's
primary
making sure something doesn't
prevention,
happen.
right? So we look at prevention. So,
Mhm.
we could look at advocating for safe air and safe water, education on how to reduce environmental risks, right? Those would be some primary prevention measures. Whereas your secondary is screening, right? So screening for lead exposures, right? Chemical exposures, right? Those are your screenings. So, and then your within, community, right? We can look at, that epidemiological, do we have a higher rate of cancers or certain diseases in that specific area that could potentially, lead to something else, right? So more of like a surveillance. And secondary could even be just looking at the neighborhoods, the schools, and other areas for any potential environmental hazards that might be present. And then tertiary, again, that's treatment, right? So if it's lead exposure, making sure that they get treatment, right? If it's air pollution, um, how, if we have asthmatic, what are some ways that they could prevent their exposures, right? So a lot of that, think of think of the population within the community and how they can be affected by some of the issues in their neighborhoods. And it could even be helping to clean up toxic waste sites, removing, other hazards. So we have to look at both individual and community when we are looking at some of these hazards. And then the last part of this is going to be education. So we look at patient education. We know patient education is extremely important. They need to be well versed in, what is going on with them. It's one of the most important things that we are going to do as a nurse. Um, and so we use provide education to promote health, to prevent illness, improve for health related behaviors, also to enable patients or empower patients, right, to care for their health conditions. Um, and so these are things that we're going to have to do. We look at, one of the most important learner related barriers is low literacy. So a lot of times we deal with individuals in the population who are illiterate or they have low literacy levels. And so this can be very embarrassing there are still plenty of people here in the United States that cannot read and write, and you will come across them in healthcare. So it is super important. Vanessa, Miriam, are you still with us? Okay. Um, so, it might be very embarrassing for them to share the information that they can't read and write. So we have to be able to assess their ability to read and write. And so what is some way we can assess somebody's ability to read?
Offer them literature if you want to be discreet about it and see how they react to it, or be upfront and ask them what their levels are of education and what do they feel like they needed help with today.
Okay. Or you can just hand them a piece of paper and ask them to read it to you, right? That would help
Right.
to assess their
Hmm.
ability to read, right? Because if how many of us, and I'm guilty of this too, you go to a doctor's office, you go to a clinic, you go somewhere, and they're like, okay, here's the privacy, here's our privacy statement, here's this, go ahead and sign it. What do we get? Do we read it? How many of
No.
you read it? Anybody?
Well, we should know it anyway, so we shouldn't have to read it.
Well, we should know it, absolutely, but does anybody ever stop to read them, really? Or do you just sign them, right? So actually
I
asking them
decided.
to read it is going to be the best way to assess their ability to read. Um, Remember too, just because I can read doesn't necessarily mean I understand, right? So there is a difference between being able to read and being able to comprehend what I am reading. Um, And so this is where, you give them the written instructions, you ask them to read it, and then you have a conversation about what they read to ensure that they understand it. Um, Culture, language, right? These also can be a barrier to learning, right? If I am not a native English speaker and you hand me information in English, what is that going to do for me?
Aggravate or confuse me, depending on the person.
Okay, well, does it gonna help me at all?
No.
It's not gonna help me, right? So when we provide information to our clients that are non-native or non-English speaking, we need to provide the information in their own language. So we can do a couple of different things there. We have translators, right? So translators are available to assist in passing off information. But if we are going to give written pamphlets or written materials, we want to make sure that we're providing those in their native language. Cultural values, personal expectations regarding treatment and recovery also may differ from, our own beliefs as well as other healthcare providers that also can interfere with the patient's ability to cooperate and learn needed skills for self-care. So we also need to take that into consideration. And one of the other big things that we need to look at when we're providing education is their motivation and their readiness to learn, right? This is a big part. Is in, motivation, it plays a large part in effective learning, right? It's just like you as a nursing student, right? If you aren't motivated to complete your classes and to complete your program, are you going to study? Are you going to read the material that's necessary in order for you to get through these courses?
Probably not.
Absolutely not, right? And nursing is one of those programs that you have to want to be here, right? Because why else would anybody torture themselves the way nurses have to be tortured, right? Nursing school is unlike any other program that you will ever experience in your life. It is extremely difficult. It's very tedious work. And it's a lot of information that's presented in a short amount of time, right? So, hopefully in
And it's
nursing,
taught by nurses.
and it's taught by nurses. Yep. Um, so yeah, because we've all been there, right? And we kind of understand that, what you are going through. But the desire to, you have to have that motivation in order to learn. So the desire, right, for them to go back to a previous level of functioning, or if they're in the hospital, the desire to be discharged and go home and be independent is usually a pretty good motivating factor, right? Um, and so we kind of have to work with our clients and our patients to show them the advantages of learning what they need to know, right? Um, and, if the patient is comfortable and the patient is rested, minimal amount of interruptions, those are usually going to be the most successful education sessions that we are going to have. It's, can be very, think about it, whether you're working within a hospital or you're working in the community. um, we see patients at their best and we see them at their worst. All right. And so working with patients that are stressed, that maybe have a new diagnosis, or, a terrifying diagnosis, or something that they don't understand, right? They need time to process that information. Think about a newly diagnosed diabetic. Here we have to teach them how to test their glucose levels and how to give themselves injections, right? And all these, how to change their whole lifestyle, right? How they eat, their exercise, all of that. And so, they might just get to the point where, like, I'll never be able to do that for myself. There's no way I'm going to be able to do that. And how do we overcome that? You know, we want them to express their feelings and we want them to be able to be open and honest with us, right? But we also have to be careful with how we respond, right? Because we want to encourage them to continue rather than get them to revert back. So, a lot of different things there. Um, Healthy People 2030 has a lot of objectives related specifically to education. We can use education to, help to prevent conditions, to reduce risks for illness, encourage and provide for healthier lifestyles, right? So, super important as a nurse in order, and to be able to provide education. So with that, we have different learning domains or different ways of learning and domains. All right. So has anybody ever done a learning assessment to see how you learn?
Yes.
So who is a visual learner? Raise your hand if you're a visual learner.
I'm
Miriam,
both.
are you a visual learner? She's not even listening. Miriam, are you a visual learner, a kinesthetic learner, or an auditory learner? All right. Go ahead, Queen. I know you want to answer.
I just said that on both. I could see things and learn it and be tactile, which is kinesthetic. It all depends. It's like situational.
Okay. So visual learners see from through what they see, right?
Mhm.
So your auditory learners, right, through what they hear, and then your kinesthetic is by performing a tasks, right? Most people learn by one of those three routes. One is usually going to be dominant, but a lot of us like multiple, right? I know personally, I am a very hands-on learner. So nursing lectures are usually very difficult for me. So how I overcame that when I was in nursing school is I wrote. I write everything. Okay. I took lots of notes and lots of notes. I used to, my husband used to say, that I should have got paid to rewrite textbooks because that's basically what I did in nursing school. But that is how I could take the information from a lecture and make it more kinesthetic. The more I wrote, the more I remembered and the more I understood. Most people, it's a variety of different ways, right? And if you look at nursing school, we kind of incorporate all of those things, right? You see a lot in nursing school, right? You see a lot, you hear a lot, and you touch a lot of things in nursing school. So we tend to incorporate all of those domains or all of those ways of learning in nursing school. We also have your domains of learning. So there's 3 different domains of learning. We have our cognitive, our affective, and our psychomotor. Cognitive is the thinking part. Okay, that's the ability to hear, read information, understand it, memorize it, and use it later. All right. So this is, how many bones are there in the body, right? It's it's the ability to have and understand and use it later. You're affective. That's your feeling part. How does it affect you? Or, this is the attitudes, the behaviors, the beliefs, the values that all affect somebody's ability to learn. Um, I know, think about like some of these people that have been newly diagnosed diabetics. A lot of people think that it's a life sentence, right? It really isn't. Maybe back in the day, it was a lot worse, but now we have so many things and so much education that we can provide to ensure a healthy life, to help them make and switch to a healthier lifestyle, right? But how I feel about a certain thing is going to affect my ability to learn. Like, for example, in EKGs, I have a mental block for EKGs. I've had it forever. Okay. So at this point, it's very effective for me, and it's very difficult for me to learn EKGs because I have it in my head that I'll never get them. Okay. And then psychomotor is the moving part. That's learning skills or tasks, right? So the best way to do and learn a task is to use the see one, do one, teach one, right? And this is a lot of times what your instructors use in lab. So you're going to either watch a video or you're going to watch the instructor perform a skill. Then you're going to do the skill and then you're going to teach somebody else to do that skill. That is the best way for you to reinforce how to do those skills. The more you practice a skill, right, the better that you get at it. If the education doesn't address all 3 of those domains, it's not going to be it's not going to be as effective. Okay. So we have to try to incorporate the cognitive, the affective, as well as the psychomotor when we're providing that education. And that will help. It helps to motivate them and helps to really get them to feel more in control of what they are learning. So reinforcing health education, okay, collaborate with patient as well as staff to develop the patient education plan, right? So we know as practical nurses, the registered nurse is going to do the initial education, right? And our job is practical nurses to go back and to, reinforce that education. So there are education, plans that can be written for your patients. The ultimate goal of your patient education is the prevention of disease, your wellness promotion, and restoration of health. So, teaching them about their disease, their disorders, how to provide for their self-care. Um, Again, I can't stress it enough, but education is one of the most important things that we are going to do. Preparing the patient education is extremely important. You are going to kind of like following that nursing care or that nursing process. You're going to analyze your assessment data. You're going to establish goals or objectives for the education, and then you're going to create a plan for assisting that patient in achieving the goals in the most effective and timely manner as possible. And then discharge planning, right? That's looking ahead, making sure that the patient still has their ongoing needs met at home. Remember, we start discharge planning at the time of admission, right? Don't plan on keeping them there forever, right? So from the moment they're admitted, we are planning their discharge. And so during this time, we have to assess if there's any special needs for education. We also have to, as nurses, kind of be able to identify when those teachable moments should occur. We also want to promote learning opportunities they should be brief. You're not going to be able to go into a client's room or a patient's room and provide hours worth of education, right? You need to be able to provide brief, focused education that's going to meet the needs, of your patient before they need. So we look at the three levels of prevention and education. All right. So primary prevention. These some of the things that would fall under primary prevention, teaching women to void before and after sex to prevent cystitis, teaching parents how to role model healthy eating, educating parents on immunizations, the immunization schedules, what diseases are prevented, right, by getting immunizations. Your secondary prevention. This is screening, right? So teaching elderly women the signs and symptoms of UTI, providing education on colonoscopy prep, giving a pamphlet of the importance of and scheduled for pap smears, mammograms, prostate exams, right? All of those screening tools. And then tertiary, right? Some tertiary for education, teaching low sodium diet to a patient with hypertension, right? That wonderful DASH diet, how to use a glucometer, giving a pamphlet with the signs and symptoms of hypoglycemia, how to treat hypoglycemia, discussing potential side effects of prescribed medications, right? These are all things, and this isn't all inclusive, right? But these are some using that primary, secondary, and tertiary for education. And so the big thing to understand here, learning hasn't occurred until behavior has changed, right? And it's hard. And I know everybody can understand that. Behavioral changes are hard. It's human nature, right? Path of least resistance. And that includes habitual behaviors as well. Change is pretty cyclic. And so we have to be able to understand that. So imagine, right? Imagine that, well, I'm just going to go 80 because it sounds like a good number. Imagine that 80-year-old that comes in and he's a newly diagnosed diabetic. He's 80 years old. All right. And you're going to tell him that he has to change his diet and his whole way of life. How effective is that going to be? It's going to be rough. Well, even imagine now if you sit back and you think about your lifestyle and some of the things that you do and that you enjoy doing, and somebody came to you and said, you have to change everything. How are you going to feel?
Scared,
Okay.
uncertain,
Scared, uncertain,
angry.
frustrated, angry. Yeah, all of those things, right? So we have to be able to present it in an information or present the information in a way that they're going to be able to understand the importance. Okay. Now I chose an 80-year-old. Why? Because we know at 80, they're set in their ways. We're not going to make a whole lot of changes at 80, are we? Okay. But what if it was a 50-year-old? Okay. A 50-year-old still has a very long life ahead of them, hopefully, right? Um, and so we have to really help them to understand whatever the disease is, whether it's diabetes, whether it's hypertension, whether they just had a heart attack, whatever is going on, we have to help them to understand the necessary lifestyle changes and how to manage their disease so that they can continue to lead a healthy, productive life. And so this is why education is so important. Um, Using, if we can't combine the cognitive, the affective, as well as the psychomotor, it's not going to be effective. Effective, not effective. So, all right. Any questions?
I have a question, but it's not really related to anything.